Yeah, so there's 12 million people in the UK who are deaf or have hearing loss. And I don't think people have any idea. I think it's a really hidden problem. Often you can't see if people are wearing hearing aids, and there's also lots of people who don't have them yet who could really benefit. Why is that actually a problem? Well, if you are struggling with your hearing and you've got undiagnosed hearing loss, you're more likely to have depression and dementia. And I think lots of people really don't understand the dementia connection. So there's lots of evidence now to show that hearing loss is one of the most modifiable risk factors for dementia.
Hello again to Innovating Healthcare. Today we're going with a subject that often doesn't get much publicity, which is deafness and the hard of hearing. It's one of those aspects of life that seems inevitable to us all as we get older, but actually is common throughout life. And I think we should be shining a spotlight on it a bit today. So I'm very pleased to be joined today by Crystal Rolfe, who's Associate Director of Health at the Royal National Institute of the Deaf. Is that correct? I'm going to ask you to introduce yourself in a second, but first our other panellists. And I'm going to make a big mistake already, Miro, so I'm going to ask you to pronounce your own surname.
It's Mirusanthan.
And where do you work at?
I work at Timber Health as the Discovery Audiological Scientist, which is within the kind of clinical research and product development area.
Right, yeah. And then Tom.
Yeah, Tom Anderson-Dixon, Director of TAD Medical, owners of the Smile Shield face mask.
So I'd like you to start introducing yourself, a little bit about your role, a little bit about what the Royal National Institute for the Deaf does, and what you'd like to get out of today in terms of, getting the message across, if you like.
Yeah, great. So my name's Crystal Rolfe. I'm the Associate Director of Health at RNID. So it's one of 4 programmes of work that we have, and the health programme is looking to make sure that that we encourage people to take action on their hearing loss as soon as they start to notice there's a problem, that audiological services are of high quality, and also that health services overall are accessible to people who are deaf and have hearing loss. So that's what we do at RNID. We've been around for over 100 years, and we're the leading charity for people who are deaf, have hearing loss or tinnitus.
Thank you, and we'll come back to some of the aspects about the profile of deafness and the commissioning of it and things in a second or two. Mira, I know a lot about your company because I'm a mentor on the Clinical Entrepreneur Programme.
Oh, fantastic.
And Krish, who is your CEO,
Yes.
was one of my first mentees on that programme. So it's very good to see something 4.5 years later in development. I think he now has 35 people working in your company, something like that, is that right?
Yeah, it's gone up a little bit more than that.
Would you like to give an idea of what it is you do and why Chris, you developed that initially? What was the sort of idea, if you like?
So Timber Health is a medical technology company. It kind of spun out the NHS, so it's a clear need to improve ear and hearing healthcare access. So Krish is an ENT doctor who worked in the London region, and he kind of saw firsthand how difficult it was giving people access to kind of basics of kind of wax removal, all those kind of things. So using that, he created a hardware, the Timber Health system, which images the ear, facilitates microsuction, which is a process of removing earwax and doing a hearing assessment. And again, so I work within Timber Health, doing clinical research and kind of aspects of product development as well.
I'll try not to tell you too much about what I know, so it doesn't disadvantage the panelists here. But Tom, what's your sort of product line, and what is it that you're interested in?
Yeah, so we own TAD Medical, and one of the products is the Smile Shield face mask. Mm-hmm. And throughout the last 2 years of the pandemic, speaking to doctors, nurses and people out in the community, we realised that it's not only people with hearing loss that rely on facial expression and lip reading. So we developed a transparent face mask, which has now gained approval from the Department of Health and Social Care, and is beginning to become widely used throughout the NHS and the wider community.
Okay, we'll come back to the importance of innovation later, but first, Crystal, would you just take us through what the scale of the problem is, and do you think people really understand that scale?
Yeah, so there's 12 million people in the UK who are deaf or have hearing loss. And I don't think people have any idea. I think it's a really hidden problem. Often you can't see if people are wearing hearing aids, and there's also lots of people who don't have them yet who could really benefit. Why is that actually a problem? Well, if you are struggling with your hearing and you've got undiagnosed hearing loss, you're more likely to have depression and dementia. And I think lots of people really don't understand the dementia connection. So there's lots of evidence now to show that hearing loss is one of the most modifiable risk factors for dementia. Also, if you have undiagnosed hearing loss, you're more likely to become socially isolated, to just withdraw from daily activities. And people also finding that they're having to retire early because they haven't addressed their hearing loss as well. So it's a really big issue, which I don't think is one at the forefront of people's minds. And it also affects how people access health overall. So it's of importance to commissioners to understand the impact that hearing loss has on other comorbidities.
I think you're absolutely right, and thinking back to my days as a clinician, it was only fairly late on in my sort of career as a GP that we started to put loops in the surgery, that we started to think about accessibility to people with other sensory losses. But certainly hearing wasn't the first of those to be looked at. So do you think that during COVID and the pandemic, when people were less able to have face-to-face consultation with their doctors, that some of the problems built up, and do you have any evidence for that?
So we're trying to find out more about how the pandemic has affected people with hearing loss. We know that people felt more isolated during the pandemic, and obviously as things went online, and particularly healthcare consultations went online, people struggled more. In terms of people taking action on their hearing loss, we know people noticed a hearing loss more, but people are really bothering the NHS at the moment, aren't they? We're not sure if that means that people might be taking even longer to do something about their hearing loss. However, doing something sooner will help with the healthcare overall, and so we don't want people to delay because they're bothered about worrying the NHS.
So during the pandemic, we did some work looking at the use of other services, and particularly things like wheelchair use and assisted technologies. And initially there was a dramatic fall off of demand, and then there was some innovation came in where actually some of the clinicians just decided we were going to do something different. Has that happened with in your community?
Well, we've seen more use of remote technology to assess people's hearing and fit hearing aids, and we're taking a really special interest in that at the moment. We want to make sure people always have choice, but we're taking an interest in which parts of the pathway could that remote technology be used in, and we think it could create some efficiencies. So that's something we're really interested in working with audiology departments with across the country. We know that there's an uptake in all different kinds of new technology, but I think the biggest thing we think that can make a difference is if people get their hearing checked. And so we're interested in people taking a hearing check. So RNID have a hearing check which takes 3 minutes to use, and we want GPs to then refer people on. We also are calling for the government to implement a national screening of hearing, and we know that that's not right for it to be an individual hearing screening programme, but we're interested in the National Health Check or the new National Prevention Service that is being looked at. And because I've mentioned already dementia being a risk factor and a link with hearing loss, we're really interested in making sure that hearing gets checked as part of that. And we're working with some dementia charities to try and get that message across.
Perhaps for another day, but obviously we screen neonates for deafness and young children as they go along. But there seems to be a big chasm until the next sort of milestone. That's usually when you're ill for some other reason. I'll come back to that later if I can. Miru, your product that you take out is in a box about this big.
Yes.
And you can do a hearing test with it, you can do an assessment of the external ear, you can now take photographs of the tympanic membrane.
Yeah.
So what's the future for, I suppose, a community-based hearing service that would, I suppose, take some of the pressure off the NHS, or the NHS can use as a tool?
So part of the work that we're doing is actually now improving access to ear and hearing care, and access is actually, there's a few points, it's about having it close to the patient's home. So it's about bringing ear and hearing care directly into the community. Traditionally, You go see your GP has a quick look, maybe gives you some olive oil. You then wait a few weeks or a few months, have a referral to an audiology clinic or an ENT clinic, and then you get assessed and diagnosed, etc. We want to actually make that pathway a lot more efficient and a lot more quicker by empowering non-specialist clinicians and specialist clinicians within the community, such as your pharmacists, your opticians, your nurses, your GPs, to be able to directly look at the ear, say there's pathology or no pathology, or actually treat one of the most common causes of hearing loss, which is wax, and then be able to facilitate a hearing screen. And again, going back to what Crystal said, that will then allow that movement of that patient directly into the correct provider for the next part of their hearing and healthcare journey. So that could be going and seeing an audiologist or go and see an ENT specialist, because there could be something really worrying going on, something chronic, something that needs real medical management. So part of what we're trying to do is actually increase accessibility and reduce the time it takes for that person to be at the right clinician, to have the right treatment.
So your next stage is going to be using automated systems to look at and help those clinicians diagnose. Before we come to that sort of AI sort of end of it, what are you? How do you get commissioned? Does the NHS commission you, or are you a private service in an opticians or in a hearing centre?
So there are a few different models at the moment. So at the moment we're working with lots of different NHS partners who are commissioning us as part of, we tend to be a service facilitator working alongside local CCGs. So the local CCG says actually we can use the TIMPA service to offer the physical requirements, examination of the ears and the hearing test. And then using our cloud-based TIMPA panel system, results can be reviewed and remotely accessed by ENT or audiology clinicians or GP clinicians in a secondary care setting. And using that method, we provide a safe and a quicker patient journey. So commissioning can vary. So we work with some companies like pharmacists who directly engage with us, and we help facilitate that journey. We train the clinicians, and we kind of provide a remote review service. So our clinicians, ENT surgeons and audiologists will be able to facilitate and deliver a kind of safe direct-to-care commuter service.
Okay. I'm just thinking you're going to be so accessible through all these different methodologies that ENT clinics are going to be quite full soon, in the sense that if that referral pattern increases, as it should do, because people have a problem that needs resolved, have people thought about how they might be going to cope with those sort of numbers?
So we, one of the main pieces of work that we're doing this year is looking at how efficiencies can be created in audiology services, so not specifically ENT, but audiology overall. And we're looking to work with commissioners and audiologists across the UK and the British Academy of Audiology to try and look at how technology, including remote appointments, can be used to do that. Of course, that doesn't mean that we don't need the right mix of skills and we don't need the right funding, but we think that there are things that can be looked at to constantly evolve and constantly bring new innovations into the pathway to make the service better for people, as well as dealing with capacity.
And of course, Tom, we had 2 years of people wearing masks.
Yep.
and one of the common complaints, particularly in shops, but for elderly people, was they couldn't understand what was being asked of them, and people were doing this all the time. So the importance of understanding both what you hear and what you see, I guess, is something you've been looking at.
Yeah, we've really looked at it within a medical clinical setting, but then also outside of that. As you mentioned, when people visit a coffee shop, I was talking earlier about how I'd visit a coffee shop and I'd find it difficult actually sometimes to understand what the lady or the chap behind the counter was saying. So it's something we're quite passionate about. And
is there an evidence base that improves that? What sort of evidence do you use to know that they're effective?
Yeah, so there's quite a few studies happening at the minute. And then we do user trials within the NHS. So one we're doing at the minute with Great Ormond Street is they're just doing a study. So the Department of Health, they had a pilot study which has now been put on pause, and they were going to see the benefits of using transparent face masks within the NHS. But then lots of NHS sites across the country are conducting their own little studies, and Great Ormond Street is one that we've provided some masks for, and they're looking at the benefits. We all know the benefits of being able to see somebody's lips and understand a lip read, but it's just for them to get some qualitative and quantitative feedback from within the doctors.
I sometimes do feel for children who've never known anything than mask doctors, nurses, etc. It must be, especially if you do have a hearing loss. Yeah, and that's you're being assessed and like that. I know they've done that very sensitively with children. Certainly experienced people I know, and we'd hoped to have a paediatrician here today who's developed a novel way of assessing deafness in children. So we'll do that another day, I guess. I suppose when you look at the government's has a lot of priorities at the moment, and I mean in healthcare, not necessarily in general government policy at the moment, which is obviously a problem time for us all. But I wonder if we're raising this up, the sort of priorities, I suspect the Chancellor of the Exchequer would want to know what's in it for him. What is the payback? What is it an invest to save type program if we improve the diagnosis and referrals and assessment of that need?
Yeah, I think if we come back to what I talked about a moment ago about the impact that hearing loss and deafness have, I think it's really clear that the savings that can be made, so I don't have a figure, but I think it's really clear if you look at the costs of poor mental health. There's huge evidence around the impact of social isolation that has economically and dementia. And then if you think of hearing loss as a huge modifiable factor for all of those things, I think it's clear that we'll save huge amounts of money. But it's not just about that, it's also about people having access to health. And so if you imagine at the moment, people aren't being able to fully access all health services across the board because of poor deaf awareness, and that also has kind of an impact on them actually having good health, which then have financial kind of impact as well. So the Accessible Information Standard was brought about in 2016, and actually we've worked with a load of charities 5 years later and identified that only 11% of NHS trusts are actually really aware of the Accessible Information Standard or actually doing anything about it, whereas they have a legal responsibility to make sure that all healthcare services are fully accessible to people who are deaf and have hearing loss. And that's just a case of good deaf awareness, and that's something that we can talk to any commissioners or any trusts about. And masks are obviously one part of that, but there's lots more as well around making sure services are deaf aware.
And we often talk about iconic personalities who can lead on these things. Are there people that you in public life that are helping you with this? Because some of the embarrassment is taken away then, isn't it?
Absolutely. It's really important, isn't it, that we don't see kind of health in a vacuum, and actually it's kind of part of the wider society. And the impact that Rose Ayling-Ellis and Strictly Come Dancing this year has had on society has made a big difference, because it's made people wake up to realise that deafness is important. It's important to make sure people are included. Also, you may have seen the film that won the Best Picture this year was Coda, which is a film about children of deaf adults. And I think those two big things have really made society realise that hearing loss and deafness are important. And we hope that the kind of healthcare sector will also realise that actually this is something that people are seeing every day, even if you don't think you are in your healthcare setting. Because there are 12 million people who are deaf or have hearing loss, even if it's hidden, you will be seeing people in your service, and it's really vital to make sure those services are accessible.
That's a very good way of putting it. I'm just going to come now back to the innovation side of this, because this series is about how we get the best access to the best products that produce the best results, if you like. And I'll start with you, Tom. In terms of getting that to market, what was that experience like?
It was quite difficult to begin with, because we developed the product and we had a lot of people that said this is great, a lot of people who suffer from hearing loss, but then it was trying to get it into the NHS. And we were talking about this earlier about how it can be quite tough to get the people with the purse strings to make the decisions and get the product in. So we started off speaking to audiologists, speaking to people like paediatricians, or even people head of midwifery, just somebody giving birth. I had a child during the pandemic and actually wore the mask, and they thought it was fantastic just to be able to give someone a smile when they're giving birth. So we started speaking to them, and then they created a little bit of pull through with the procurement departments.
And yourself? Yeah.
Yeah, so obviously Christian was the one that did all the hard work initially, but I think one of the reasons as to why the Timber Health System has been so successful is there was a clear user kind of need by the clinicians, and there was a direct patient benefit, which then meant that a lot of clinicians championed for the product. A lot of clinicians could see a clear and easy requirement of this product within the clinical setting, within the community setting, which then meant that they were able to directly influence their leaders to kind of encourage the use of our products within their health systems.
So you've got access to a very large membership, both of other organisations working with you and citizens who have hearing loss. Is there something that the NHS could be doing through its various innovation strands to help improve, to get to the best care that you could do? Are you working with them on anything like that?
I think it's less about innovation and more about kind of adding in some really, really simple things. So for me, the biggest thing that the NHS could do is, or that people with hearing loss can do, and the NHS can do really, is support with getting your hearing checked early. So it's great to look at new innovation, and we want to do that, like we said before, with bringing technology and remote fittings into audiology services. But for me, the biggest thing people can do is check their hearing, and the biggest thing the NHS can do is encourage people, once they've had a hearing check, to get referred through to audiology, and we'd like to see hearing checks as part of some kind of national health check. And so sometimes I think it's about the simple things, and innovation's really important, but that's just such a simple thing that could make a massive difference to all of those other health conditions we've talked about.
Potentially the best innovation during the whole of the pandemic, possibly after the vaccines, was the fact that we immediately went to non-face-to-face and could people could still get access to some service. So I think little things do make a big difference, but then if they weren't done before, they're still innovative. So in the sense that you're improving that access which wasn't there before.
And sometimes things change as well, don't they? So we've seen that something that's happened as an unintended consequence of the pandemic is that wax removal services have really decreased across the country, and you've talked a little bit about wax removal, and we'd really like to make sure that it's understood why wax removal is important as a vital prerequisite to audiology, and kind of a simple way, a part of hearing loss that you can remove. And so we'd like to make sure that people have, high quality wax removal services as they did before the pandemic. And sometimes it's just about upholding that level of that standard of service that was there before.
I have a mother that won't wear a hearing aid because she has wax in her ear. Getting the service to her is difficult, so I live and breathe this. I think we'll wind up soon in terms of this debate, but perhaps you could just Crystal, sum up what you think are the most important things that need done over the next year, let's say, to improve the quality of care for people with deafness or hard of hearing.
I think there's three big things. So I think it's about raising the profile of checking your hearing, and that's for people with hearing loss and for healthcare providers. And there's something about making sure that audiology services are providing the high quality standards that across the country that they should be, so following the NICE guidance and that commissioners are commissioning to that NICE guidance, and bringing that kind of new innovative remote fitting software in. And the third thing is about just general access to health. It's about making sure that all health services are following the accessible information standard, and making sure that they are thinking about people who are deaf, have hearing loss in terms of simple deaf awareness for their services.
So you're reminding us what good looks like.
Yes.
That's essentially what you're doing. And Tom, for you, what do you see as success in the next year?
I think just to add on to those kind of things, obviously with the things like the Smile Shield, it's quite simple, quite cost-effective option. In the NHS, a lot of infection control departments and nurses are promoting the use of face masks, not just for COVID, but for other things like colds and flus and other airborne viruses. And it's just a simple thing we can use. So to use them not just within audiology, but within other areas, whether that's A&E or whether you're working in paediatrics, because you don't know who you're going to come across. So it's quite a simple tool really to be able to use.
Or in your coffee shop.
Yeah.
And Mira, I know you've grown very rapidly of late, but in terms of, I'd like you to tell us a little bit about some of the AI things that you're talking about doing and what the future holds for diagnostics in the community.
So one of the kind of key things I actually want to reflect back onto what Crystal said is we've got this 12 million population with hearing loss, and there's an increased demand for hearing services, but there is a huge barrier to increase the number of service provisions in the UK because staffing, skills, technology, etc. And what we've done at Timper Health is actually facilitate that journey quicker. But we've also been able to empower non-specialists to be able to provide high quality care. We've done this through a few different ways, and we've kind of built safety systems such as our remote review platform. One of the next things that we want to implement is an artificial intelligence diagnosis system. So using our hardware system, you take a picture of the eardrum, and then the artificial intelligence will be able to examine that picture and say, if there is an abnormality or if it's completely fine. If there is a problem, then it kind of gets flagged up the kind of chain of command, and then it kind of allows that clinician with that patient directly to be able to advise as to what to do next. So by empowering this non-specialist person to be able to make a decision quicker and to be able to take that person from a community setting directly into the right secondary care setting is where we think innovation is actually going to take place. So we want to kind of really go down this route in the next year or two and really develop the service with our partners in healthcare.
So we've got automated recognition of radiography now,
Yes.
chest radiography, in breast screening.
Yeah.
So this is adding to that list of like pathology, looking at
Exactly.
what a normal looks like, differentiating it very quickly so that you can triage people, in other words, for more serious illness.
Exactly.
Thank you very much. I think we'll leave it there and thank our panel, Crystal, thank you very much, Miriam and Tom, and I hope you've enjoyed this episode.